Hi, this is Dr. Corey Maas on Looking Your Best. I wanted to talk a little bit today about resurfacing and some of the myths that are out there about resurfacing, and really assuage some of those myths, because resurfacing of the skin is a technique that is certainly not new, and one that we know revitalizes the skin, and if done correctly can really totally eliminate fine lines and even deeper lines and wrinkles around the face and neck area, and now we're even using it on hands and the décolleté chest region. The principle of resurfacing is harnessing the body's power for wound healing. And so what we're doing really is injuring the skin in a very controlled way, down to and including the second layer of skin. It's called the dermis. And we're into the second layer of the second layer of skin, the reticular dermis, often papillary and reticular dermis. And once that injury is achieved in a very controlled way again, the skin will remodel itself. It'll lay down new collagen. It'll remodel the existing collagen to be nice, even, parallel bundles of collagen which smooth the skin. And it'll actually lay new skin cells over the surface, which gives the smoothing effect. Common targets are around the mouth, around the eyes, typically when we're doing aging face surgery. In sun-damaged and wrinkled skin, we can do the entire face, neck, and chest area, and even the hands and other body areas now using fractional resurfacing. The categories I've described before resurfacing are pretty universal and commonly known. The first and original one was doing sanding or dermabrasion of the skin. It's a very technique sensitive way of doing it, and it really, with the rotary wheel or dermabrader, it can be quite effective, but it's messy and most people don't choose to do it anymore. Deep chemical peels came around in the 60s and certainly have been really refined since then, and there's a very nice way, of controlled way of getting a good improvement. And then finally there's laser resurfacing, which really has two categories. Original full laser resurfacing, which I stopped doing in the 90s because people were red for too long and really got way too swollen, and now fractional laser resurfacing, where there's tiny little dots of thermal injury that are delivered in the area or target area that we're doing. All of them are good techniques. There's nothing wrong with any of them. They all do, in the right hands, the same thing. They harness the power of the body's wound healing, and it doesn't matter whether you're 8 or 80. They all do the same things, and the power of the skin in remodeling itself is phenomenal, just absolutely phenomenal. Questions come up often about, well, if you do resurfacing, do you thin the skin? The answer is absolutely not. It's the opposite. The dermal layer actually thickens. The second layer or foundation layer of the skin will thicken. Temporarily, of course, while the skin is healing, it's not thicker, but as it heals, that second layer gets thicker. The epidermal layer with the dead skin cell layers is thinner initially. Eventually it comes back to full thickness with a little bit thicker dermis. And I think people confuse that with the image of over-peeled skin, or skin that has been treated too aggressively, where they've lost all the pigment or nearly all the pigment, and they have that sort of pearlescent, almost translucent appearance to their skin. That's where a peel's been done too deeply, resulting in pigment loss, and that's a very uncommon in today's world. In fact, I've never seen it, just due to depth of injury. That's an uncommon side effect, hypopigmentation. But there's a big difference between lightening of the skin, and there's relative lightening, and then there's absolute lightening. The relative lightening would be if you had sun damage on your face and neck and chest, and you just did the face, you'd have clearing of the pigment on the face, but the chest and neck would still be sun damaged. Versus real lightening or hypopigmentation, where you just really lost the pigment. Again, quite a rare incident, but very different than thinning of the skin. A common misconception with resurfacing that really doesn't happen. In general, resurfacing creates thickening of the second layer of skin of the dermis. It improves the distribution of pigment. It treats fine lines and wrinkles, and is a great option for many people who have aging and sun damage related changes to the skin, typically on the face, but also the neck, chest, and hands. If you have any other questions on resurfacing, please don't hesitate to write me an email. Send me a picture at drmaas.com, at our video blog, or you can go to our website, maasclinic.com. I'm welcome to have all those questions, and certainly invite anyone to send a video or photo that we can discuss either privately or publicly and get you the best possible results. Because in the end, it's really always about looking your very best. This is Dr. Corey Maas on Looking Your Best. Thank you.